Good afternoon, and thank you for your patience. Welcome to the National Press Club. I'm Mike Freedman, the club's 113th president. I'm the former general manager of CBS Radio Network, currently executive producer of the Kalb Report public television series with Marvin Kalb, and journalist in residence at University of Maryland Global Campus. We join today to formally announce a new initiative we are calling Help the Heroes, a partnership between two historic Washington institutions, the National Press Club and Howard University Hospital. We're pleased to have with us Anita Jenkins, CEO of Howard University Hospital, and Edward Lewis, Director of Public Policy Communications for Toyota. We'll hear from both of them in just a few minutes. Ms. Jenkins will need to depart at some point after her comments in order to make another scheduled appointment, so we just wanted to make sure everybody's aware of that. For the club, this idea emerged when we hosted Dr. Ernest Grant, president of the American Nurses Association, this past spring. At the conclusion of that interview, which was conducted via Zoom, many in leadership and on the staff of the club saluted him with what had become a new tradition in cities around the world, clapping hands, banging pots and pans, and shouting appreciation for doctors, nurses, and other frontline medical workers who were leading the fight against the pandemic, often at great personal risk. For all of us that day, and for Ernest Grant, it was a warm and momentarily satisfying experience. As time passed, we wanted to do more. We wanted to find a way to help those frontline workers directly and in a sustained manner. And we wanted to help here in our own community. Finally, we wanted to do something that focused on the fact that people of color are at especially high risk from this disease. Howard University Hospital is our neighbor, just an 11-minute drive from where we're standing right now. Several of our members and staff live in the community surrounding the hospital. So do many of the nurses who work there. They are quite literally our neighbors. Executive Director Bill McCarran and his team created a plan to provide meals to the hospital staff on a regular basis. And this program we officially launched today will help ensure that of the many things Howard University Hospital nurses and other healthcare workers do, one of them, enjoying a healthy meal, will be taken care of for a day. No shopping or cooking or cleaning up. We'll share more about the why in just a few moments. Right now, it is my pleasure to introduce Anita Jenkins. Ms. Jenkins has an impressive career in the healthcare field. She is relatively new to Washington, having arrived in February from Dayton, Ohio, where she was president of Sycamore Hospital and COO of Kettering Medical Center in Dayton. Ms. Jenkins earned her MBA from Walden University. She has expertise in respiratory care. And Anita Jenkins is already making an outstanding contribution to our community. She helped Howard University Hospital navigate through the first wave of the coronavirus and now is helping to prepare her team for what could be a very challenging fall and winter flu season. We are fortunate to have someone of her background and leadership skills organizing the hospital's response. Please join me in welcoming Anita Jenkins to the National Press Club.
It is my honor to join this distinguished group. Thank you so much for your invitation and, of course, your mission. Thank you for your sponsors, Toyota and others, for saying to our heroes, we appreciate you. It was an interesting start to join Howard University Hospital. My husband and I moved to Washington, D.C. to do a great work. We wanted Howard to become the top performing hospital in Washington, D.C., and that, of course, is still our mission. But we started February 17th along with a few of the other new C-suite members at Howard University Hospital, and so did COVID. So our attention was focused on what needed to be done. My eyes were opened, and I was able to see better how our company performs. What's the real truth about our community? The press club, what do? You are truth tellers. And it was so important for me to understand really the community that we serve, the organization that we honor, and the work that we had to do. So it was very important to just dive in and make sure that the people we took care of were taken care of well. It was very clear to us from the very beginning when COVID started that our team was under great stress, that our highest of employees, our physicians, our nurses, those direct patient caregivers, not only had to deal with the patients that they served, their families that they worried about, but they too were afraid. But then we realized that someone cared about their lives. Our community came in and said, here's a meal. We have adult children, my husband and I, and the first thing I say to any of them, have you eaten? And that's a loving, motherly, family thing to say as I joined the neighborhood you so kindly spoke of. Have you eaten? And what you said to our heroes was, here's a meal. We want you to be fed. Each and every day that a meal arrived, and if it didn't, that's okay, but when it did, the caregivers were, energized. Someone in the community cared about what we were doing. There were times when we were working, and that was me, 12 hours a day, just diving in. What needs to change now? What kind of work do we need to do? Oh, the CDC says we have to move this and change that. And oh, we've lost 5 people, 5 patients over the weekend. It was a lot to deal with. But then someone stepped in and said, have you eaten? So I want to thank you very, very much for thinking of Howard University Hospital, this historic hospital, that we want to carry into the future with a partnership with Adventist Healthcare. We want to change Howard University Hospital, keep serving, keep making sure that we are ready if that next wave happens. We want to make sure that we are ready for the current patients that we serve. We've learned a lot, and we are taking care of the patients that still have COVID and our regular patients as we have opened up to make sure that we are caring for those who need regular care, heart attacks, surgeries, having babies. So I thank you very much for thinking of our staff and our employees as heroes. I think of them as that as well. And for asking, have you eaten? I appreciate you very much, and I hope to continue this relationship. Thank you so much.
Thank you very much, Anita. You're a powerful force. It's nice to have you with us, and yeah, quite a time to be moving to Washington.
Yes.
We are indeed honored to have you with us here today and in Washington in your position. The most vulnerable link at a hospital during a pandemic is the front line, the patient-facing staff. Personal protective equipment, PPE, is a challenge. Equipment, such as ventilators, is a challenge. Available hospital beds are a challenge. But when the staff is exhausted, physically and emotionally, and absenteeism rises, that can be the single biggest problem for the delivery of care. Nurses are counted on for so much. Allowing them to rest and recharge for the next day is an ongoing challenge. Over the course of the pandemic, we've seen instances of hospitals around the country that could not keep up and ultimately sent patients across town or even out of town. This leads to stress on those other medical care facilities as well. Providing easy access to a healthy and complete meal will not solve all of the challenges they face, but it will help address one issue in the lives of some of the most important people in our community. And the National Press Club is well positioned to help. In fact, it is our honor to do so. This program wouldn't be possible without contributors. Today is the formal opening for Help the Heroes. Today marks the starting point for the leadership of companies and foundations as well as individuals who can help us toward our goal of raising $300,000 that will cover the cost of food, labor, packaging, and delivery, and will help us fulfill this mission and help get us through this pandemic. I'm very pleased to report that even before today's official launch, we have found our own heroes of this project. One of them is Mr. Ed Lewis. Ed is a longtime member of the National Press Club. He's part of the leadership for Toyota in the United States and is well known here as a member of the board of directors of the National Press Club Journalism Institute. He is also a Howard University graduate. When Mr. Lewis heard about Help the Heroes, there he was. He stepped up immediately. Thanks to Ed, Toyota has both made a generous financial contribution to the project and is providing assistance with transportation, a critical component and a daily need for the project. We are so grateful to have Toyota on board as a partner for Help the Heroes, and we're looking forward to others who will take Toyota's and Mr. Lewis's lead in joining the cause. It is now my honor to welcome Mr. Ed Lewis. Ed?
Thank you, Mr. President. Good afternoon. Two of the business pillars of Toyota are continuous improvement and respect for people. We call that the Toyota way. In these uncertain times, it's important to show that we have the utmost respect for our healthcare workers who are on the front lines, and they're juggling multiple challenges, often a great sacrifice to their own families, and for those who have been infected with the coronavirus themselves. They deserve our help. Today, on behalf of the U.S. employees of Toyota, we are announcing that Toyota will make a $5,000 contribution to help our heroes get off the ground. And as you've heard, this announcement is personal for me. I am a graduate of Howard University. That's where I got my journalism degree. It's also where I met my wife, and it's also where our two kids went to school. So, and as you've also heard, that I've been a member of the press club for more than 3 decades. And during that time, I've served on the board of the club and also as treasurer of the club's Journalism Institute. So I'm fortunate to be connected with both these iconic institutions. Now, as you've heard, as I learned more about the program and ways that Toyota could be more helpful, I discovered that the press club staff was actually making 2 round trips to the hospital each day, trying to serve or package more than 100 meals in each vehicle. And so I got to thinking, I said, well, wait, if you're doing that with several vehicles and hospital staff, that's got to be a burden. So in keeping with our principle of respect for people, continuous improvement, today we are also announcing that Toyota will loan the press club a 2020 Sienna minivan for the next year. Hopefully by then, we will have recovered and the pandemic will be behind us. So thank you very much, and I can tell you that the first tank of gas will be on me. Thank you.
Thank you so much, Ed. We are so appreciative of the support of you and your colleagues at Toyota. You've stepped up, and nobody could ask for more than that. For those of you who can also support us and the Help the Heroes program, here's what you can do. Log on to press.org/HTH. There you will find more information about the project and a link to where you can make a contribution by credit card. If you'd like to meet with us, as Mr. Lewis did, and discuss creative contributions for your organizations, such as employee matches or help in recruiting other businesses in your sector, we're very pleased to collaborate. I can share with you that pre-launch, thanks, of course, to Ed and what he just told us, we've raised some $10,000. That includes 20 donors from among our members. we have this beautiful van from Toyota and a special contribution from another leading company in Washington, D.C. We spoke with the Washington Post Company about Help the Heroes, and they asked if they could be our media partner for the project. And we are, of course, honored to have them. As a result, there will soon be a full-page ad in the Washington Post about Help the Heroes, a full-page ad. The Post will also be contributing through outreach via its new food-related social media channel. This is the type of help we need to drive the fundraising forward in this effort. So we say thank you, Washington Post, for your gracious and substantial support. As we go forward with Help the Heroes, we're going to be sharing images of the good that happens at Howard University Hospital. Highly skilled nurses and other professionals working with courage to save the lives of our community members and to support the community. It happens every day. We can never see enough of it, and we're pleased that these positive images are going to be shared through this project. We are journalists, and we're members of our communities. As journalists, as Anita said, we seek the truth. We seek to gather, sort, and report the news with accuracy and with fairness. And we say here at the club, journalists are witnesses. To silence the press is to silence the people, silence accountability, and silence the truth. It's been a tough year for all of us, and we salute our own colleagues on the front lines covering the pandemic, as well as the demonstrations for social justice that are playing out across our country. We are also members of our communities, as was the case in the aftermath of September 11th in New York and here in Washington, and as was the case in New Orleans after Hurricane Katrina. We and our families are affected just as others are. We care. And today, we are, in our own small way, expressing that care and concern and trying to play a helpful role through this program. There are images around us in the room today of our team arriving at Howard University Hospital from our initial efforts. We conducted a test run yesterday and delivered freshly made meals to the hospital staff as part of our testing phase. Let me offer a word or two about how this all works. The project is organized between the community relations team at the hospital and the club operations staff here led by Miguel Dominguez. Meals are planned, prepared, and packaged by our culinary team led by Chef Susan Delbert in our very large kitchen, and all deliveries include some vegan meals. Meals are loaded into vehicles at our loading dock. They will be loaded into that big Toyota van. And our delivery team, led by Ed Eigenfritz, will be transported in an 11-minute drive to Howard University Hospital. At the hospital, the exchange is made from our vehicle to hospital transport carts. Care is taken to ensure contactless exchanges and in compliance with all pandemic protocols. We will not enter the hospital itself. Hospital Community Relations will organize the distribution of meals to the staff and will keep a rotation so everyone receives a turn. They also will execute the paperwork that documents the delivery. Delivery times can vary if necessary, but for now it's set for the afternoon hours, around 3 to 3:30 p.m. in that window. We've completed a total of 2 test runs for a total of 200 meals in order to work out the logistics. Our goal at full funding is to deliver 300 meals a day, 5 days a week. This is well within the capacity of our kitchen. Howard University Hospital has a total of 2,400 employees, so we can do more. We plan to begin in October with 100 meals a day and 2 days a week, and then we'll ramp up from there for both meals and days. We can do more than 1 delivery per day if needed and if funds allow. Club members are being encouraged to write notes that can be placed inside the meal containers so hospital staff will know they have our support. This is part of the information on the website, and for our club members, it has been conveyed via our wire service. Here are two Washington institutions, both over 100 years old, getting together to meet a community challenge. There's no government involvement here. There's no public funding here. This is two iconic institutions that are not far apart in distance, coming together to make a positive difference. Once again, we offer our heartfelt thanks to Toyota and the Washington Post for joining Bill McCarron, his team, and our members at the National Press Club in making this project a priority. And we hope others will join us going forward. Once again, the web address to learn more and offer contributions is press.org/HTH. We thank you all for your time today, and we'd be pleased to take your questions if you have any. Thank you. Not hearing any questions in the room, I will again thank our wonderful team here at the National Press Club for ensuring that this news conference was live streamed. We thank Anita, we thank Ed, we thank Bill McCarron and his team, and we thank those of you that are here in the room with us for participating. Thank you all.